Welcome back. March is National Colorectal Cancer Awareness Month. It's dedicated to increasing screening rates, promoting prevention, and supporting people diagnosed with the nation's second leading cause of cancer deaths.
And more younger people are getting that devastating news. Now, recently, the passing of 48-year-old James Van Der Beek caught national attention after he was diagnosed with colon cancer 2.5 years ago. It's a diagnosis and a treatment course that this Maple Grove mom knows all too well, but she is crediting her care team at Minnesota Oncology and a life-saving colonoscopy for her incredible outcome. 2 years ago, Jess Leth, a wife and mom of 2 teenagers, received life-changing news. You were 44 when you were diagnosed with colon cancer.
Correct, yes.
Was this a routine colonoscopy? What was going on?
It was not. So I was having some symptoms for probably a year and a half before my colonoscopy. So I was concerned.
She raised concerns with her primary doctor and was put on an acid reflux medication. But she had a feeling something else was wrong.
Hoped my symptoms went away. They did not. So I scheduled with a different clinic in August. They got me in for colonoscopy in October, and 2 days later they called and said, there's cancer in your polyp. So I had 1 polyp removed, and that was cancerous.
Colorectal cancer is a disease that I feel like once we thought was an older person's diagnosis. You're seeing more and more young people.
It's not uncommon for me to see people in their 40s or 30s, and last week even somebody in their late 20s. And so there's definitely a trend to younger and younger patients. How did things go after your last treatment?
Good. I took medicine for nausea, and that was helpful.
Dr. Nisha Jacobs is Jess's oncologist at Minnesota Oncology. She says Jess being so proactive definitely helped save her life.
And I always tell people, pay attention to your body. Don't blow off the symptoms, because oftentimes, we know our bodies. We know when something doesn't feel right. And so rather than just blowing it off, it's easy to just to go checked out. And if it ends up being nothing, great. But then you can be proactive and get it checked out to catch things earlier.
Jess was experiencing reflux, diarrhea, and bloating. But Dr. Jacobs says pay attention to other symptoms as well.
So obviously blood in the stool. So, not just once in a while, because the hemorrhoids is common too, but if there's sustained blood in the stool, losing weight without trying. If you are noticing that you're more tired, that could be a symptom of anemia too. And then anemia is one of those things that indicates you're losing blood in the stool. So it's these non-specific things, abdominal pain.
I had surgery on December 5th to remove about 1 foot of my colon and rectum. It's called lower anterior resection. That's the surgery. And I got a temporary ileostomy bag. So I had that. With that, they removed 42 lymph nodes, and 1 of them was cancerous. So that moved me to stage 3. And so I was referred to Dr. Jacobs here at Minnesota Oncology.
12 rounds of chemo later and a surgery to reverse her ileostomy bag, Jess is doing well. Can we say that you don't have colon cancer anymore?
Yeah, I have no evidence of disease. So I think that's the term they use now. I've had a couple scans since I stopped chemo, and both have been clear. All my blood work is great. So I feel very fortunate.
We want to welcome Dr. Aneel Damle, the president of Colon and Rectal Surgery Associates, a division of Minnesota Oncology. We're so glad you're here because there's a lot of fear, there's a lot of questions about screenings.
Sure. So let's have you highlight the importance of screenings, especially when it comes to getting a colonoscopy.
Yeah, colon cancer screening is incredibly important. So having a colonoscopy actually reduces your chances of dying from colon cancer by 90%.
That's huge.
I have an example from just this morning. I had a patient who was never going to get a colonoscopy, but at the urging of her sister, she went in to have one. They found a colon cancer. She came in for surgery, and we got her pathology back this morning. I told her we'd be sharing this story today, and her pathology came back showing a stage 1 colon cancer. Wow. That means she has a higher than 90% chance of being cured from this potentially life-threatening problem.
And she had no idea that she was living with this.
Exactly right.
Because there are really no symptoms at first.
Most people don't have symptoms. Yep, you're right.
Okay, so if she would have not gotten a colonoscopy and waited a year, 6 months, maybe even, it might be a different outcome that you're giving to her.
Yeah, it can, these diseases can progress over time. And the further along that you get in terms of stages, the lower your likelihood of cure is.
Yeah, we were talking, and I know, Dr. Damle, you were saying, everyone poops, you guys. This is the reality of our lives, but people are hesitant, or they're embarrassed, or they're too macho.
The stigma.
Yeah, but it's rather feel silly than die of colon cancer, you were saying.
Yeah, exactly right. I mean, you drink some Gatorade, you have some diarrhea, you have a life-saving test.
Right.
And so when you look at that in retrospect, if you're not going to do this for yourself, do it for someone that you love, because it's not that much to be able to go through. And I've never had a patient on the other side that came out and said, I can't believe how difficult that was.
Right.
Sure.
Right.
And it's even become more simple as technology has
You're
advanced,
absolutely
too.
right.
Yeah, this is the prep right here on the table. And I had a colonoscopy a few years ago, and I was shocked because I remember my mother drinking what looked like motor oil when I was a child.
Goodness.
She's going to love that I'm telling this story. But it was
Terry.
not a great experience to watch her do that. And so I was thinking that's how it was going to be for me. Gatorade and Miralax is really what we're doing now, right?
Yeah, so we used to have the jug, which
Yes.
nobody wanted and everybody feared. We've gotten away from doing that for most people, and we can do this low volume split prep. So when I did my colonoscopy, it was a bottle of Gatorade the night before, a 32-ounce bottle that we'd sip on over an hour or two.
Mm-hmm.
In the morning, a second bottle of Gatorade. And that's the entire volume that I consume.
With the Miralax.
With the Miralax. So it's a colorless and tasteless powder. It dissolves right in the Gatorade. And so you'd split one before and one after. The other split preps that people do, they'll do both bottles of Gatorade in the evening beforehand. And it's not something that you have to, chug to drink the whole volume of as fast as you can. You can put on some Netflix, you can watch The Real Housewives, and you can just
Sounds like a break to me.
Sip and go.
and just, I was going to bring my martini shaker so you can have it nice
Oh
and
my
cold.
goodness.
Yes, that is the trick. You want it to be nice and cold,
Yes,
right? Because you are
exactly.
drinking a lot of Gatorade. But doctor, thank you for bringing this in. I think this really shows people that it's not like it used to be. It's doable. And again, like you mentioned, you'd rather not have colon cancer. Just if you feel silly, it's okay.
Yeah,
It's okay.
exactly. You're in good company.
Thank you so much.
And a reminder that you are in control of choosing your cancer care team. Minnesota Oncology has more than 100 cancer care providers in 13 clinics across the Twin Cities, including new locations in Maple Grove and Hudson.
And the Colon and Rectal Surgery Associates recently joined the practice, expanding comprehensive care options. You can learn all the details at mnoncology.com.
Up next, we